Hello, and welcome to this episode of A Cancer Conversation with the Georgia Cancer Center at the Medical College of Georgia at Augusta University. My name is Chris Curry, and I am the host for this podcast series. Thank you for joining us today. So today we are going to be talking with Dr. Lauren Bigham. Dr. Bigham is the director of the Georgia Cancer Center's Psychosocial Oncology program, correct?
Correct.
All right, and your role, you lead a team of specialists helping in the mental and emotional aspects of cancer treatment and care, correct?
Correct.
All right. Well, thank you so much for joining me for today's discussion.
Thanks for having me.
Absolutely. I like to begin our conversations by sharing a little bit of information about those who work here at the Georgia Cancer Center. I feel that it gives those watching or listening kind of an opportunity to learn a little bit more about the people who work here, their backgrounds, their interests, etc. So can you tell me what led you to pursue a career in psychosocial oncology, things like that?
Of course. Actually, a lot of people don't realize this, but my background is in sports psychology.
Okay.
So when I came out of undergrad, I had always played sports. I'd always really enjoyed that. And what's best than maybe a master's in sports psych, which was housed in kinesiology at that time. So I went to Georgia Southern for that. During that time, I learned that to really have optimal performance as a human being, we have to have a team, right? When an athlete goes out and runs a marathon or swims a mile or plays golf or tennis, you're really looking for optimal performance, but it has to have a team of so many people around that human being. The coach, the assistant coaches, maybe athletic trainers, maybe physical therapists, and also maybe a mental conditioning coach.
Okay.
I found that really being part of a team and really taking care of the entire person allowed for people to engage in their sport in an optimal way. When we think about health, we oftentimes think about health as this kind of unidimensional entity, right? We oftentimes think about physical health. Mm-hmm. But we know that there's a lot more to health than that. We know that there's emotional health, there is physical health, there's spiritual health, there's financial health, there's behavioral health. So to really get optimal performance, we have to support kind of the larger understanding of health, to take care of the entire person. And when an individual has a team and we can take care of all the dimensions of their health, they can finally perform optimally.
Yeah.
Which was an incredible and fulfilling experience and a lot of fun. But the same we can say here at our cancer center. We can really support optimal functioning, optimal health. We can support our patients in getting the results that they want by taking care of all of them, the entire person. So we have the best doctors, we have the best medicine, we have social work, we have nurses and navigators, and of course we have psychology here. So we can finally take care of the entire person and support them in optimal performance against their cancer or whatever health condition, and helping them get the results that they want.
And it's important for really any illness, but when it comes to cancer, you really are talking about a range of emotions: anger, sadness, depression, anxiety. Like, there's a lot to unpack there. And so how important is it to have someone like you here helping people, not just the cancer patients, but you also work with their caregivers or their family members too, don't you?
For sure. And we can talk more about that. So we know that emotional health or well-being can really impact how an individual thinks and what they also do. So let's pretend that a person is feeling upset or sad or down or worried. Sometimes those emotions can actually lead to more of a kind of a state of kind of loss of energy, not motivated, or even paralyzed, they're not really going to engage in their care for that result that we all want. So by taking care of their emotional well-being, we can also support their behaviors. We can support their thoughts, their attitude, maybe even their mental toughness during this experience, to really support that entire person. So I'm actually a health psychologist, so I further specialized after sports psych. I found the light, so to speak, and I realized that I really enjoy health and health psychology. So again, that optimal performance regarding kind of healthful living. So as a health psychologist, not only can I help our patients with the anxieties and the worries and the depression and the adjustment and the stress associated with a major medical concern, but I can also help them improve their physical health.
Okay.
So I help our patients get better sleep.
Oh, wow.
Yeah. I do a lot of work around insomnia without medications.
How does that work?
Oh, it's very neat. It's the most fulfilling thing to watch somebody start to become well rested. It's a different person that sits in front of you.
Yeah.
And then they feel like they can really engage in their care here. So how it works is it's a little complicated, but again, we look at their thoughts and their emotions and their behaviors, and maybe how to tweak some of that to improve their sleep quality.
Okay.
I can also help with pain management without medications, and how we approach pain and approach suffering. We can actually reduce an individual's suffering.
Oh, wow.
And reduce the impacts of their pain on daily living. I can help with medications and how to take all the medications we prescribe around here.
Because there can be a lot when it comes to cancer.
There can be a lot, and my gracious. Or even helping with physical activity or health behavior change, weight loss. We know that that's a significant factor in cancer care and cancer reoccurrence.
Yeah.
I can help with, gee whiz, you name it, we can support. So we not only kind of the emotional part, but the behavioral part, and helping our patients get the physical health that they want. Stress and family. Okay, so
they can go together sometimes.
They can. Before this, I was just trying to identify a quote by Viktor Frankl, who's a pretty famous psychiatrist. This gentleman is a founder in my world, and really founded existential psychology. And one of his quotes, and I'm not gonna do it justice right now, essentially states, a stressful reaction during times of hardship is actually normal behavior. So stress and stress management for our patients and for their families at times can really get in the way. And it's distressing.
Yeah.
It's not a life well lived.
Yeah.
So there are times when we can really support our family or our patients by supporting their families.
Yeah.
So not to bring up sport again, are you familiar with boxing?
I am familiar with boxing,
yes.
Yeah.
Okay, so you have the boxer in the ring, but there's some really important people around the ring, right?
Oh, yeah, absolutely.
Yeah, so what do they do?
They are basically cheering them on and also watching the fight to see sort of where the openings are, the weaknesses are in their opponents, and then discussing those during or in between the rounds while they're giving them water, fixing up some scratches,
bandaging some bruises here or there.
Yeah.
Okay, so the fighter has some folks and has people in their corner.
Yes.
Right.
Yes.
So depending on who's in our corner and how they're doing, they can be really helpful. They can kind of bolster us back up, give us a kind of a pep talk. They can put us back out. They can kind of move us back into the middle of the ring.
Yeah.
We help our patients do just that, and we help their families also do just that. We know that to provide that optimal kind of treatment for our patients.
That's the key word today. I feel like the word today. The word of the day is optimal.
For sure, right? Because that's what we're all hoping for.
Yeah.
That's what we all want.
Yeah.
So to do that, we support their families so their families can better support our patients.
And so I'm getting this image of the boxing ring. Thank you for that. Of like the cancer patient in the middle of the ring, the family members or the friends just outside the ring, and then our teams behind them just outside the ring. So because those caregivers, those family members, those friends, those are the people that they see, 24 hours a day, 7 days a week, 52 weeks a year, so on and so forth.
Yep.
But they don't see us all the time. They don't see you all the time. But you're always there.
We are. And we're present and we're part of the team. And we want to collaborate. We want to really join with them on making sure that our fighter in the middle of the ring is doing what they need to do and in a really meaningful and intentional way.
Yeah.
That's our goal. So we take care of our patients. We take care of their families. And I want to make sure that we talk about that this is not all about being crazy. This is not about being strange or sometimes my patients will say, Doc, am I crazy? No.
Yeah.
No.
I imagine crazy and strange are not words that you like to use very often at all.
Gosh, no. In fact, I think my patients are some of the strongest human beings I'll ever meet.
Agreed.
It's impressive. To really be careful with the words that we use, that again, to undergo a major medical condition is stressful. And sometimes it makes us feel like we're in distress, but we're not crazy.
And we don't have to dive too deep into it, but there is a lot of discussion about mental health in America as a whole. So it really does take a lot of strength to choose to engage with a psychologist, a psychiatrist, to talk about what's going on, whether it's cancer, heart disease, the loss of a loved one, whatever the case may be.
Very much so. And unfortunately, there's a lot of stigma there, isn't there?
Yeah.
There's stigma around this kind of idea of being crazy or having something wrong with you. Gosh, no. No. The only thing that's wrong here is the cancer.
Yeah.
Or the health concern.
Yeah.
But to come in and to really be able to have space and time to identify how an individual wants to approach their health. And we serve as guides in that process to offer evidence-based treatment to help them get that better sleep or reductions in the suffering associated with pain or improvements in mood. We're there to support them. And those things are normal in this experience.
And why is it that you chose, so you're talking about your background and your training and all that. It sounds like you could have chosen a number of fields to follow psychology and that sort of psychosocial stuff. Why oncology? Why'd you choose that?
That's a good question. It's the patients. It's our patients. It's they're unbelievable. The things that they do and they encounter and the way that we can really support them and make life really meaningful and intentional and improve quality of life. I just fell in love with our patients and really supporting them. There's nothing better than seeing a patient who, they feel like their back is up against a wall, but there's nothing better than being a guide for them so that they can feel more empowered and having a life that they're proud of.
What does it mean to you personally and professionally to be able to connect with these patients?
Oh, it's a gift. It's a gift that I cherish, and also, as you can probably tell, I don't take very lightly.
Nope.
I know it's hard to come in and talk to a psychologist. I understand that, and I know that there's a lot of stigma there. So I'm really proud of our patients when they come in and say, "Gee whiz, I want this to look different." okay, we'll work on that. We'll work towards that.
Yeah.
That is the incredible amount of trust that our patients put in us. So we don't take that lightly around here.
Can I ask you how you balance the connection and the emotions that come with it between your professional and your personal life? Because I imagine it can be very heavy. I'm not an expert, I'm not trained, but I can imagine it can get very heavy at times.
It can. It can. And to have some radical acceptance of that, to be a person entrusted with another individual's innermost thoughts and emotions, to see other human beings go through some real hardship. It can be hard. I don't know if I'd have it any other way, though. That's actually why I likely came away from sports psychology into health psychology.
Why is that?
There's just something to helping somebody with their... Sport will always be there, and I love it.
Yeah.
Don't get me wrong.
Yeah.
But there's something to being a guide to another human being as they're improving their daily life. Marathons and sprints and races and games, those are fabulous. But what's even more fabulous is helping somebody really construct a life well lived.
Yeah. And you talk about the different types of health. There are a lot of different resources available to, patients of different diseases, including cancer patients. And the social workers that work under you, that work with you in the psychosocial oncology program, they really are the key to helping patients connect with those resources.
For sure. I like to call them our magicians.
Okay.
They're fabulous. Social work is such a vital key team member here. They offer resources, referrals. They support our patients with getting access to home health, physical therapy, durable medical equipment, transportation, which is such a concern right now in our world, to help our patients really to remove the barriers to care. It's been I almost used that word. It's been a wild world we've lived in for the last couple of years.
Yes. Definitely.
I think we all can agree on that.
Agreed.
And our economy has suffered.
Yeah.
Utility and rent, and many times our patients have to make some hard decisions about, do I get to this appointment or do I pay this bill?
Yeah.
Or how do I make sure there's food on the table? No cancer patient should have to make those decisions. So our social workers, we have 4 of them here in our cancer center. They really help remove those barriers to care and take care of, again, that entire person, helping them get transportation, helping them utility assistance, rent assistance, meal assistance. They're our magicians.
And I went through Leadership Augusta training a couple of years ago, and one of the simulations that we did was really living on a very strict budget. We weren't living with an illness, but we had a very strict budget, and there were different agencies and organizations available to us. We had to find ways to get to them. But there really are a lot of resources out there to connect people with when they need different kinds of help, not just financial help. I mean, that's a huge one, yes, but there's lots of organizations out there that are ready to help that people just don't always know about.
I agree. And our social workers do a nice job of really staying engaged with our community and aware of what's being offered, not only locally, but across the state and also on a more national level. So, for example, here we are a bone marrow transplant team. So we do transplants for the leukemias, the lymphomas, and the myelomas. That's a tough road. and one in which we really want to be able to provide whatever resources to benefit our patients, because it could be a year process and financially difficult, and if you live local, fabulous, but if not, what do we do then, and how do they stay in the area?
Yeah.
But also can be a scary process. And our social work team is very familiar, for example, with a lot of the national organizations like LLS, the Leukemia Lymphoma Society, or Be the Match, and they offer peer-to-peer programming for our patients. So you can be matched with somebody who has a similar cancer, who's similar in age, similar in background, who's also going through transplant, and you can be able to talk to them and really get a sense of what's this all going to look like.
Yeah.
And being aware and knowledgeable of those resources and getting our patients connected, even on the national level, with some of these programs, it can be so meaningful and also just really productive for our patients. So they just do a fabulous job. Can you tell? I can't really speak
like it.
anymore. They do a nice job.
Let's talk a little bit about, so one of the reasons that I wanted to talk with you and for this episode was really to unlock the power of the psychosocial oncology program and help patients understand the resource, what it means, that it is available. So obviously patient privacy, very important. But are there sort of some general questions, common questions that you get that you can help people understand that their question's not a dumb question or whatever? Like it's a honest question, I guess.
Oh my gracious, we receive a lot of questions. The "am I crazy" is certainly a very common one. No, our patients are not crazy. They have cancer, or they might have another major health concern, but certainly not. We also get a lot of questions about, how's this going to look, and what does it feel like or look like to see a psychologist? Mm-hmm. They don't quite know. Sometimes I've been asked, is this what I saw on The Sopranos, or is this what I saw on TV, or
Which is really not a lot. I mean, it is a frame of reference for people. They see psychologists and psychiatrists on television shows or in movies.
For sure. We do not look like that.
I imagine sitting in the chair and somebody's taking notes on a notepad.
No. And in fact, there's no long sofa. There's none of that. It's really a space that we can unpack and identify how the patient wants to best move forward with different other evidence-based treatment. It's really short and brief. I usually also encourage homework with our patients so that what we practice... homework. It comes back to haunt us. But we know that we want change and we want something different. So we have to kind of practice how we play.
Yes, we have to work for it.
And so homework is involved. So practicing some of the skills that we utilize and talk about and generalizing them outside of our beautiful cancer building. Mm-hmm. It being short and concise, and we don't want our patients to be in therapy forever.
Yeah.
We have a beautiful cancer center, but they do not need to be here forever.
Right.
They need to go back. They need to be with their family and friends and living a very meaningful, engaged life. So I'm often asked, okay, what does this look like? What does this entail? Will I have to be in therapy forever? No, we prefer not. And we work towards kind of getting people back to where they want to be pretty quickly.
And also giving them strategies and things that they can do in their own lives and their own daily interactions to handle
all of this.
Yes.
Mm-hmm. Other questions that I might get, actually, we receive a lot of questions about their health and their health diagnoses and treatments. And sometimes we come into the room, and I prefer not to wear a white coat. It was not the tradition I was trained in, and I really honor that tradition. But sometimes by not wearing that white coat, I find that Sometimes our patients confide in us a little bit easier. And they ask all sorts of questions about treatment and medications and procedures. And it's a nice opportunity to really support our patients in identifying what information they want, that they're really hoping to get, and then how to ask those questions of our teams. It can be a little unnerving at times to ask a physician, what is this? Can you say that again? What do you mean? We support our patients in those tricky conversations at times. And also treatment decisions, how they want to move forward. Sometimes they say they're recommending surgery, they're recommending radiation and chemo, but I'm not sure I want all this. And so helping our patients find their way forward is also a role that we play here.
What sort of training do you do with the physicians and the nurses? Because obviously, when the patients are telling you these things, with respect to patient privacy, I imagine that you're talking to their physicians about their concerns and helping in guiding these patients and guiding these physicians to learn how to really talk to one another and connect with one another. What does that look like for you?
Yeah, and we're part of this interdisciplinary team, and all for the benefit of our patient. So whenever I start a therapeutic relationship with a patient, we talk through what that can look like and what the patient feels most comfortable with, in making sure that we first and foremost adhere to their privacy. And so it really depends on what kind of the patient's preference is. But our patients are informed that we're a treatment team, and that to some extent their providers will be able to access my documentation.
Gotcha.
And so they'll be aware of what we'll work on. But my role here is to really support the patient and the team in having a very fruitful, engaging kind of relationship. So can I answer? It depends.
Yeah, that makes sense. I mean, obviously different patients have different levels of privacy, and we are absolutely going to honor them. But I'm just thinking of, different communication styles. There's all this research about different communication styles. I've gone through some of those classes. And so, doctors may be thinking one communication style when the patient may be wanting another communication style. So there's that disconnect, but maybe that patient is confiding in you and talking about that. And so you're able to go back to that doctor and say, hey, the next time you talk to whoever, consider this, or something along those lines is what I'm thinking, is one of the sort of the general things that I'm thinking.
Yeah, and again, it really depends on the patient and what they feel most comfortable with and what they consent to and agree to. But I find that to help the patient really advocate for themselves is a way that I can be most helpful. So if they are looking for more of a conversation, that maybe they'd like more information or education, and how do we make sure that we get that in a very brief appointment? So for many of our patients, we talk about how to request maybe an appointment slot that would be a little bit more conducive to that.
Okay.
Especially after scans or tests or procedures, when they feel like, okay, I need a little bit more time here to have a better understanding of what's going on, reasonably enough. So maybe advocating when's a better time to have a little bit more time with the physician, or what's up my top 3 questions that no matter what, I want to exit that room with having answers to. Writing them down.
Sounds like homework, right?
Yep, homework. Love homework. And so they know, because, when you're in the middle of these appointments, it's a little nerve-wracking for us all.
Yes.
It doesn't depend who you are. So having those written down, coming in, bring a family member, have somebody on the phone, multiple ears, and go through 1, 2, and 3. And then if you need more time, go ahead and schedule another appointment. So really helping our patients better advocate for themselves.
Okay. So if someone schedules an appointment with you, what does that look like for that first appointment? What should they expect?
A conversation.
Just like this one.
Yep, exactly like this one. To expect so we the pragmatics is to be early so we can start on time, because I really want to ensure that we spend the appropriate amount of time. So our appointments are 50 minutes to an hour.
Okay.
And to really talk through what prompted the referral or this request to come see a health psychologist, what the patient is feeling as though is concerning, and what would they like to look different? What would they like to work on? So having some goals in mind or some directions. And specific things that they'd like to work on, whether it be adjustment or stress or coping or family, sleep, pain, medication, adherence. How do I remember all these medications? So from there, I'll ask all sorts of questions to have a better sense of things and to really better inform a treatment plan. So by the end of the conversation, we can decide what would be the most appropriate treatment plan for this patient. If not me, then who? And then what would treatment look like? So they're informed and they're all in.
Yes.
But also during that conversation, we talk about the patient's strengths. What's working? I don't want to work from a deficit model. I see our patients as incredibly strong and resilient. We want to identify those strengths. We want to identify the things that our patients do well, and we want them to hold tight to those as we work on some of these other things. So hopefully it's a time and a space that our patients can take an inventory of what's going on, what do they want, and what do they want to look different, and what are they doing well. All within a 50-minute to 60-minute appointment.
And then they can schedule additional appointments if they need to.
That they can. That they can. My hope here at our cancer center is we're growing a mile a minute. So our fabulous medical teams are also growing a mile a minute. So we're bringing on another psychologist here, as well as we've started a fellowship program and an internship program here. And hopefully as we continue to grow is to not only offer individual therapy or counseling, and we also meet with patients on the inpatient side as well when they're hospitalized, but is to really grow in the other interventions that we can offer. So more group work around stress and sleep and pain, new diagnosis, to offer other interventions that our patients will really benefit from. Support groups as well. We need to bring those back.
Yes. COVID-19 kind of put a damper on.
That they did. That it did. But I'm looking forward to really offering maybe even more holistic treatments here, like chair yoga, Tai Chi, music therapy. So we're looking forward to growth.
Absolutely. Always.
Very much. All for the betterment of our patients.
Okay. Well, Dr. Bigham, I appreciate you sitting down with me today for this conversation. I feel like it has been very informative. I hope it has been very helpful for those who are watching or listening today. And so thank you again for taking the time to sit down with me.
Of course. Thank you.
Absolutely. And remember to follow, rate, review. Let us know how we're doing. You can find A Cancer Conversation on most podcast platforms, Apple Podcasts, Google Podcasts, Spotify. Just search A Cancer Conversation or Georgia Cancer Center, and you should be able to find us, and we'll see you next time.